So we've just heard at some length from the President of the United States about this new deal that's going to replace NAFTA. And he said it's the most modern trade agreement in the world, and it is going to be great for all three parties. But let's talk specifically about something that might be relevant up in Minnesota, which is the dairy farmers. Because he's made some progress, he says, with getting some access for dairy products in the United States into Canada. How's that going to play in Minnesota?
I think it's going to play well, and I can tell you, as somebody who tried to sell Talenti gelato to Canada some years ago and was terribly disappointed that NAFTA essentially precluded us from doing so at a competitive price, I really do celebrate the opening of the dairy market to some of our farmers, and I think that's thoughtful negotiation, and I'm pleased to see it.
So does that take one issue away from you as you challenge for the seat?
Well, I don't look at it as issue taken away or giving to somebody else. Fact is fact and truth is truth, and no party has a monopoly on good ideas. And I call truth like I see it. In this case, the opening of our dairy market, the dairy market in Canada to some of our farmers and producers, I think is good progress. And I'm for free trade, but I'm for fair trade. And I think anything that moves us to that end is good for this country.
So let's go to a different issue, and that's health care, because we saw a poll that indicated the relative importance of subjects, and it appeared that your district, perhaps more than some other districts we looked at, really puts health care up toward the top of that list. Is that your experience?
It is, and the district that I hope to represent is rather affluent and well-educated. Most have health care coverage, but it's a very thoughtful district and a selfless district, recognizing that too many people in this country lack coverage. Too many people are one illness away from bankruptcy. And I'm of the opinion that it's time for our country to make the moral decision to ensure that everybody has health care when they need it. We spend twice as much as any developed nation in the world. Health care consumes 18% of our GDP. I will make the argument that the dollars are already in the system, but the way that too many billions of dollars are removed from the table prevents us from delivering care when people need it. We can do better. I've got some plans to do so, and I hope to have that opportunity.
So the Republicans, of course, have tried to eliminate Obamacare. Are you saying hold on to it, or are you saying actually advance it and take it even further?
Well, David, I believe the ACA took some steps in the right direction. It is imperfect. It needs to be stabilized and fixed. I will absolutely agree to that. But I also think it's time for Medicare to be expanded around the country as a buy-in option to those who desire it, as a thoughtful public option, not taking private plans away from people, not putting private insurers out of business, rather providing yet another option and, frankly, the freedom to choose what's best for people. I want to see Medicare negotiate pharmaceutical pricing because our country right now subsidizes the entire world's pharmaceutical pricing. I do not believe that to be appropriate, and we could save up to $230 billion over the course of 10 years, according to the CBO. But what nobody's talking about, David, and what we need to is a reformation of the care delivery model. Right now, we reward, provide incentives for, and reimbursements for procedures and hospitalizations. We need to be a country and a system that rewards prevention. And by investing in health rather than sickness, we can do a lot better, and I believe save the dollars so that everybody in this country can have care when they need it and join the rest of the developed world.